A lot of these MOUs cover a 5-year period, 5 to 7 year period. So global grant is where we can still make bigger and better impact. I'm pleased to hear on the chat that Rotary, in terms of polio anyway, part of that success is due to some of our partners such as UNICEF and so on and so forth. So now we invite clubs to participate, read the MOUs, and see how they can fundraise to help partners.
Thank you so much, Rotarian Amos. This juncture, I'd also like to invite Rotarian Eric Mbenga. Eric is a holder of a master's degree in public health in management of health systems and services. He also has a postgraduate diploma in project management and a bachelor's degree in biomedical sciences, specifically medical biotechnology. Eric has extensive working experience with renowned funders and partners such as Emory University, National Institute of Health, Bill and Melinda Gates Foundation, Cambridge, Government of Kenya, Center for Disease Control, Government of Tanzania, USAID, BFTW, DFID, Christian Aid, Oxfam Novib, Global Fund, World Bank, among others. He has over 12 years of progressive experience in middle and top management level positions in research, health, and development programming, with experience from diverse organizations. He is robust in designing, developing, managing, and evaluating projects and grants, implementing community development projects, cycles, and capacity development of development partners, organizations, and communities locally, and nationally, and internationally. Eric is astute in managing multiple and complex partnership and teams with good training design and facilitation skills, poised to transfer knowledge to diverse audiences through participatory approaches. Welcome, Eric.
Thank you so much for the invitation, and thank you for having me this evening, and thank you also for the participants that have joined this breakaway session. Of course, I have to acknowledge the presence of our moving dictionary, PDG Gita Manek, amongst the other members of the fraternity. Yeah, so basically this breakaway session, I think we were to talk about our partnerships, and as we all kind of allude to, we're just coming from a background where we have about 2 months ago been declared Africa wild polio virus free. But just to re-emphasize at that point to say that this is really talking about the cases of people who are living with polio, who we definitely need to continue to take care about. And just as the other one said, as it was been presented by the Vice President in the plenary, the focus is now even more hard for us to ensure that we do not have a relapse of polio, wild polio, back into our populations, because as we continue advancing this fight against polio, we need to be more vigilant for now to ensure that we do not have a reappearance of wild polio virus. So our purpose today was just to touch base on what or how the partnerships that have worked to ensure that we did indeed have a polio-free Africa, and who has been supportive, and what should continue, or what practices should we continue to sustain going forward. So the major focus of this partnership going forward is to uptake of the vaccine, both uptake and use, and also to develop and get resources to increase also the availability of these vaccines, because as we all know, the process of developing vaccines and making them available is both costly and tedious, and therefore it requires a lot of funding to ensure that there is visibility. The other aspect of this is just also to ensure that there is increased mobilization, social mobilization, especially now with the current uptake of social mobilization as a tool that we are using to increase uptake of social services and health interventions. And that comes in with other forms of health promotion around edutainment, social mobilization, and the likes. These resources that we also need partnership for is to increase the ability and capacity of countries to provide surveillance so that we are able to identify when there's a new case or when there's a suspected case of polio so that they can be resolved. So just to mention a few of the key players who have been in this game and who we continuously look for in the partnership as we go forward is the global entities, UNICEF, Gavi, of course the Ministry of Health, of course the World Health Organization, and the Bill and Melinda Gates Foundation. If you all know, and this is where all Rotarians, we are continuously requesting to increase our fundraising, Bill and Melinda Gates Foundation has been providing a challenge where they were matching our contribution for the End Polio campaign. So as we do that, we also need to continue conducting our small stakeholder salience to establish what are these partners that we have on board and what is their relative strength, and also at the same time try to identify what roles they play, because we do have partners that we have realized may not necessarily be for the vaccination, and those are some of the challenges that we have to identify and respond to them with the right appropriate messages. I know we have talked about you've all maybe for those participants from Kenya and for those who who are aware in places where we've not ruled out wild polio virus, for example, the Afghanistan and associated countries, you would know that those countries still do not have the right approach and the right education to vaccination, and in some areas there's resistance to vaccination, just as there is resistance to vaccination by some religious sects in countries where vaccination is taking place. So our focus globally is also to try and ensure that these particular partners who have have an opposition of a way or the other to vaccination are also made aware to either support or reduce the pressure on or against the vaccinations, so that when we have resources, we can have the rightful resources going for the rightful cause, and we ensure that the surveillance for wild polio is sustained and continuously children are immunized and vaccinated against polio to ensure no relapse of polio. I think that is our specific focus, both at the country level and also at the district level, speaking on behalf of the district and the program, just to sustain this visibility to ensure that there is no relapse of wild polio in the countries that have been declared wild polio free. I think that would be my opening remarks, and I would then throw out the mantle back to the host for maybe the question and answer session.
Thank you so much, Eric. Members, at this juncture, I'd like to open up to everyone or anyone who has any feedback, a question. And also remember that out of this, we ought to come up with a proposal on the way forward based on the discussion that you're having, which will be later presented at the plenary session. So if you have a comment, if you have anything to share with us, kindly raise your hand and then we'll allow you to speak. Yes, Fardin Khan. Welcome.
Good evening. My name is Fardeen Khan. I am basically representing UNICEF here with the Communication for Development section. I am from India and I'm supporting here for the polio and immunization program in Kenya. So I have done polio program in India as well as in Nigeria, and presently I'm in Kenya. So I would like to share some of my feedback and my experience here regarding polio program. So basically the challenge which I feel here is what Eric has already mentioned. It is there, but apart from that, I'll go more focused on what I have experienced and observed at the field level. When I was, I'm present at the field level in the campaigns. What I have observed that in Nairobi, even in Abuja, also in Nigeria, I have seen the high-rise building where the vaccinators are not allowed to enter. Nowadays, it's becoming a challenge. There is no virus, I understand, but vaccinators are not allowed to go in by the security agencies, and they look at, with very high hope to go inside. They are very highly motivated, but their motivation goes down when they're not allowed to go in and to, vaccinate the children of very rich people. I understand that they go for their routine immunization, but as the virus is circulating, these SIAs, that is how we are conducting SIAs, and these extra doses are important for children. But anyhow, this is what I feel is a big challenge. So there is a need for partnership with the security agencies, with the high-rise building, the owners, the developers of the flats and buildings. So this kind of partnership, I don't know who these people are, how rich they are they Rotarians or from corporate world? But this kind of things are needed in coordination with the Ministry of Health. We have the listing of all the, it's not that everywhere, but we have specific listing of the areas where we have these challenges. So this can be mitigated through the coordination mechanism. Another challenge which I have seen is on the border of Ethiopia and Somalia, in Wajir, Garissa, and Mandera counties. I was there in that. It's a security constrained area. It is difficult to move in that area. Apart from this security issue, there are issues of nomadic population also, which is they are bordering from Ethiopia to Somalia, Somalia to Kenya, in some of the porous borders. That is one of the challenge. And for that, we have done the nomadic mapping through GIS tools and other things. And we observed that some of the areas are not even a part of the Ministry of Health's micro plan. They're missing, entirely missing in that areas. So we try to engage all the nomadic leaders and members, the chief of the villages. That is one area which I see, because in even Gavi, recent Gavi 5-year plan also, we have observed that they mentioned that immunization also, we are reaching 90%, but 10% are always left out. Even in polio campaign, I have seen every time we reach almost like 80-90%, but 10% always left. So these 10% children who get missed out every time with the vaccine, these children living in this kind of area. They are nomad, they're unreachable, they're not even in the micro planning of the government. And I have observed that due to resource constraint, or I don't know which reasons, IPV vaccine, which is very important in restricting circulating vaccine-derived polio virus, that is in scarce. I don't know why the production is not there or why it is not there. So IPV is very important for routine immunization. So that vaccine shortage I have seen in India also, in Nigeria also, and in Kenya also. That is important, but I don't know why this vaccine is always losing. Apart from that, I'll share my experience of India. India is now polio free, but we have engaged petrol pump associations. There are associations, chemist associations, like petrol pump owners, they offer one banner from their own side, one petrol pump with one banner. That itself gives so much of visibility and not a big cost. The amount is not too much, and one petrol pump owner can afford one banner for polio. And so many vehicles used to come there for petrol, and also it's a very good IEC which is available. There are chemist associations who help in resolving the non-compliances. Apart from that, I feel that in Kenya, there is a need to have a partnership with the embassies of Somalia, Ethiopia, India, and China. So many population living here, and they are against polio vaccine. They are resisting. We have the list of this. So if the embassies are involved and engaged, there can be a sort of pressure on the people, those who oppose this vaccine. Apart from that, there should be a partnership with the Ministry of Communication to stop the rumors. Here, I don't know why, but even if there are rumors in social media and other, there is no mechanism to stop them. There should be a central mechanism where these rumors or negative news can be restricted, because it affects the program in a big way. It gives a setback to the program. So that is very important. Apart from that, I feel that partnership with Safaricom, where bulk messages can be sent for immunization program. ATM and banks, they can also support in partnership. Transport associations, they can also support. And lastly, the media, they should be very positive, whether the social media or a print media, mixed media, any kind of media. If they are always positive and the media workshops we keep on engaging media in a positive way, it gives a very good result for any program, not only for polio and immunization, but it gives for HPV or measles, rubella, or any campaign in the country when we do. So I feel these kind of partnerships are extremely important for polio program. And these are the partnerships done in other countries. That is how those countries get free of polio. So even in Kenya, I believe it's not there, but these type of partnerships are extremely important, especially in the nomadic areas, because we have done nomadic mapping for Wajir, Garissa, and Mandera only, but there are so many other counties where there are nomads. So there is a need for research and finding out other nomadic areas and to incorporate them in the micro planning of the government. So, and I end my views here with this, my note. And I hope that with this group, we'll come up with more suggestions and more solutions to it. Thank you so much.
Wow, that's quite a lot and quite good input. Thank you so much for your input. We still have time, so if anyone else has something to input, kindly raise your hand, and then do share what you have for us.
Peter.
Yes, Amos.
Just a very quick comment on what Fardeen Khan has just expressed. Those are some very valid points. And what we can do is move slightly away from what we've been doing in the past with Rotary. We just signed a letter of intent with UNICEF in terms of a partnership with the WASH programs, with the back to school program. But just based on what he's just suggested, we can very quickly look at other partnerships with the Ministry of Health, Safaricom. But of course, there's some legalese that has to get involved with this. But all the same, those are very good ideas, and we shall take them on board. Thank you.
Thank you so much, Amos. Indeed, he has shared quite a lot. Yes, we still have time, so if anyone else has something to add, you're welcome.
I see.
Thank you. This is Gita.
Yes,
I put my hand. Yes, thank you. Thank you for noticing me. And Eric, it's good to be with you again today. I really enjoyed listening to both our district speakers and Fardeen. Eric, you were great, and so was Amos. But I think that the points, as Amos has said, brought out by Ferdinand are extremely important. Those are the ones that have been overlooked. And as much as we focus on all the other aspects of polio immunization, awareness, surveillance, we need to pay a lot of heed to the gaps. These are the gaps, and obviously they've done some research and some really academic work on these gaps. So I think that we need to talk about that as you report back to the main group. But I'd like to stay, Amos, in touch with Mr. Fardeen Khan, if you can organize a meeting for us so that we can take this message forward to whoever is required, not just, you know, we upload him today and then forget about what he said, because it's extremely relevant. If we are to succeed, we have to get you know, hold of all the marginalized and forgotten and unreached populations. So Fardeen, thank you so much for bringing this to our notice, and please let's continue the conversation. I hope that I have given you my email on the chat box, but if you can also share yours with me, and Amos and us, we can get together and make sure that we formalize these gaps and make sure that they are covered. Thank you.
Thank you so much, Gita. Yes, we still have some few more minutes. So if anyone else has any reaction or anything else to add or an input, you're welcome.
We have Tim and Sebastian from Ethiopia. Maybe they can give us a little bit of an idea from where they stand in Ethiopia.
Yes, good evening. This is Rotarian Sebastian, the current president from the Rotary Club of Addis Ababa. Hello.
Hello.
Hi.
Yeah. Input is currently difficult to give because our main polio-related meeting is in the near future. But being working and being currently due to COVID in my golden cage in Addis Ababa, I was quite interested about the speech, especially about the border area and the pastoralists between Ethiopia, Kenya and Somalia. And I would love to support any attempt to reach out local media and or embassies. Me being German would be more or less the German. My help would be guaranteed, and I would love to support. Email address I could give in the chat. Thank you very much.
Thank you so much, Sebastian.
Tim
Yes, Tim.
Tusink, past president of the Addis Ababa West Club. Fardeen had some great points. I appreciate those. And the ones he mentioned about the border areas in Ethiopia and Somalia, those have long been challenges in many areas of public health. They're not easy areas to address because they're rather out of control of the government and the Ministry of Health, but we certainly do need to keep focused on that. Ethiopia has had very good immunization programs for a number of years with quite high immunization rates. One of the things, I've been a Rotarian since 1983, and I well remember in 1985, Polio Plus coming online, and it's brought tears to my eyes in the main session to hear what has happened. I mean, I've watched this unroll, but to see Africa be polio free and kick polio out of Africa, I remember that. I remember hearing Nelson Mandela talk about it. We have so much to be proud of, and education of the general population, what Rotary is doing. We need to keep focused on that. We need to really keep going on public relations. Great job has been done in the past. We just we never should drop the ball on that. Keep telling people what we're doing and bring more and more partners. Rotary's been great at bringing partners online, and we need to keep doing that. So keep encouraged, everybody. We need to keep doing this. And the plus part, that is so amazing. I used to think that was just vaccines, but the pluses we've worked now with COVID. How amazing. So keep going, Rotarians.
Yeah.
Thank you so much, team. I can see that we're running out of time. The counter is counting. We still have some few seconds. So thank you so much, everyone, for attending this breakout session. It has been quite wonderful having you around. Karibu sana.
Karibu, thank you.
Vice President, distinguished Rotarians, distinguished guests, Rotaractors, family of Rotary and friends. I'm sure you've had a very stimulating conversation in your breakout rooms, and shortly we'll all be back together in this plenary session. We're going to just pause for 2 minutes while the rest of us are back within the plenary, but I'd like to use those 2 minutes to pose a question to the KEPI manager, Dr. Collins Tabu. Dr. Tabu, there's a question here. The question is, how can we Rotarians advocate to increase polio program funding in the county budgets and perhaps even in the national budget? This is given that we predict that funding at county level in budgets may be difficult in the future. Dr. Tabu, kindly answer our question, please.
Thank you, Ambassador Ojambo. I'd like to be brief around this question. It's a critical question, and we appreciate the role the Rotarians have done over time. The Rotarians can advocate for increased funding for us through engagement of the leadership at the various county levels and even the national level, as you have always done. Just to have a focus on polio eradication, immunization, and other high-impact maternal and child health interventions. But as we do this, I would like to urge Rotarians to continuously again demand accountability from us as the Ministry of Health, as the National Vaccines and Immunization Program, and again with a focus on the efficiency in the operation so that we can realize a lot more for us as a program with the little funding that we do have. And third, encourage a lot more of integration of the polio eradication and game strategy activities with the other maternal child health interventions, high impact interventions, so that within the countries then we realize aspects of sustainability, and within the country we stop looking at individuals in terms of a disease with a disease-based interventions of mind,